Hello everyone, I'm Dr. Najad, and in this video we want to show how to evaluate the CT scans for a trauma case and what should we seek for and how to assess that. For evaluating the trauma cases, it is really important to know from where you should start and how to end the evaluation. It means that you should not try to scroll very fast the CT scans and try to see all the bones all together. You should keep in mind that you should try to evaluate step by step. Okay, so for checking the trauma and the fracture lines, we try to assess where there are overlapped or where actually there are apart. It means that we try to evaluate the gaps and also the dense lines, which shows also there is a fracture there because there are overlapped. So we try to check up to down or try to bottom up. Okay, that's a technique for evaluation and also for the surgery and to start the trauma case and for the fixation steps. So to start the CT scans, I check from bottom to up. It means that I try to check first the symphysis of the mandible and the body of both sides of the mandible. Okay, in this case, I see a very large fracture there and a displaced fracture. We can see that it starts from here at the symphysis on the left side to the right. It is the oblique direction. So it is hard to manipulate because we try to actually keep these parts together and then fix. The reduction is too hard for this case, and it will be more hard if there is a fracture of the TMJ. So again, I scroll and try to check. Here I see another gap, another fracture on the body of the mandible on the left side. And again, I start, that case actually was referred to me. The first fixation by the wire was done by another colleague, but he couldn't complete the case. He tried to fix the fracture and to prevent the displacement further until actually he came to my office and I evaluate that for the surgery. After the body of the mandible, I check for the angles. There is no problem there, but I see a fracture here on the right side again. I scroll more, and the important case, here I see the maxilla, but it is not important yet. I want to check the TMJ of the mandible on the both sides. Okay, the head of the TMJ is okay here and here. I don't see any fracture. The neck of the TMJ is also okay. And again, I go back, I start for evaluation of the maxilla. For the maxilla, I try to check the dentoalveolar fractures. Also, I try to check for the Lefort lines. Also check for the buttresses of the Zygoma. So I start here, the maxilla. Again, I see the arc bar was inserted by my colleague to fix the displaced teeth and also the fracture of the maxilla. Here I see the dentoalveolar fracture, the teeth are displaced, and here I see the palatal fracture here on the right side. I continue, and for evaluation of the Lefort fractures, I need the coronal view. So I change my view here. Again, I start from the lower part of the mandible to double check my fracture lines. That if you remember, there was a fracture on the symphysis. Yes, I see that again. The dentoalveolar on the right side. I check for the body of the mandible, which I saw the fracture lines on both sides. Okay, here. And again, I check for the TMJ head and the neck, and I start to evaluate the maxilla. For the Leaford one, you know the fracture line is passed through the nasal preform and the lateral wall of the maxillary sinuses, and that goes to the connection between the trigoid plates and also the posterior of the maxilla. So I see here the Leaford one fracture that starts here, buttresses of the maxilla, the preform on the both sides, fracture of the nasal septum, and also on the right side that continues. I double check that with the axial view to check for the trigoid plates. If it is displaced, so the maxilla is completely dislocated. So I see the fracture between the trigoid plates here and the posterior of the maxilla, and the maxilla was completely mobile during the evaluation, because the examining the patient and evaluation, that's the first step, and after that we check for the CT scans. So I continue the evaluation. I check for the zygoma. I see the fracture of the zygomatic arc on the right side. Also, I will see the fracture of the zygomatic buttresses on the both sides. That makes me suspicious to the fracture of the Leaford 2. So I double check that with the coronal view again. I see the fracture on the inferior rim of orbits on the both sides, and also the nasal bones on the both sides. So that shows the Leaford 2 fracture. That patient has the Leaford 1 and Leaford 2 fractures simultaneously. Again, I will complete that. I see the fracture of the zygoma on the right side, the lateral wall of the orbits, especially the zygomatico-frontal sutures. And that shows the Leaford 2C, the inferior rim of the orbits, and the zygomatic buttresses on the both sides. That continues to the posterior sides of the both sides of the maxilla. So I will continue that and try to check for the nasal bone. We evaluate that the both sides of the nose was fractured, and again I will see that on the axial view. You can see that the nose is displaced, but for evaluation it is really important to check for the cryptus and also the sound of the nose during evaluation. It is really important to understand the fracture of the nose is old or new. Actually, clinical examination leads you to understand that is old or new. And at last, we check for the frontal bone, the frontal sinus, to see if there's any fracture there or not. So easily you can complete your assessment going a step to a step and a step-by-step evaluation. That makes it really easy for you to understand where are the fractures and to complete your examination by the CT scans. And by mixing the coronal and axial view of the CT scans, actually we can rebuild the 3D shape of the patient. That helps you to understand the whole compartments of the face all together, and also to show the fractures to the patient. But it is not as precise as the cuts of the CT scan. It means that you should evaluate the coronal and the axial and the sagittal cuts of the CT scans, and at last you can check for the 3D view for the patient. I can see again the fracture of the symphysis that goes to the body of the mandible. That shows that that fracture we saw on the body of the mandible actually was the continuous the excess of the oblique direction of the symphysis fracture, and we saw that on the last cuts of the mandible. And also the TMJ is normal and there is no fracture. The nasal bone is fractured on the both sides. The inferior rim of the orbit is again, I can see the fractures, the Leaford 1, Leaford 2 fractures, and also the right zygomatic bone is damage there. So that's a kind of a panfacial fracture that is really hard to manage. On the next videos, we show you how to manage this case, how to start and how to end a very difficult trauma case like that. Thank you for your attention. I'll see you on the next video.